Assalamu alaikum. Here we will be doing Norma Frontalis. So first I'll be telling about the bones which are forming Norma Frontalis. First we have this frontal bone, then we have maxilla. Here we have the nasal bone. Laterally we can see zygomatic bone, and this is the bony orbit. And here this lower jaw is formed by mandible. Alright, so here we have the frontal region. In frontal region we can see that above the medial part of the orbit we can see the superciliary arches on both of the sides. Then we have this glabella. Glabella is this median elevation between the two superciliary arches. Then we have nasion. Nasion is actually where the internasal suture is going to meet with the frontonasal suture. So this point right here would be nasion. Then we have frontal eminence. Frontal eminence on both of the sides, that is the eminence or the elevation above the superciliary arch. So this eminence here and this eminence on the other side as well, these two are known as the frontal eminences. So now about the orbital openings. We have the margins of orbital opening. So here we have the supraorbital margin. Here we have the infraorbital margin. This is the medial orbital margin and this is the lateral orbital margin. About the supraorbital margin, this is formed by the frontal bone, and infraorbital margin is medially formed by maxilla and laterally formed by the zygomatic bone. Then we have medial orbital margin, which is formed by two bones. First we have frontal bone, and here we have the frontal process of maxilla bone. Then we have this lateral orbital margin, which is formed by the frontal process of zygomatic bone, and here we have the zygomatic process of frontal bone. So again it is formed by two bones. Alright, so here we have supraorbital notch. Here we have the infraorbital foramen on both the sides. Then we have, here we can see, this is the superior orbital fissure inside. So this one is the superior orbital fissure. And here the one which is on the side of the orbit, that is inferior orbital fissure. Then we have this anterior nasal spine.